Everybody, hi, folks. We're back, and we are here with our 9 o'clock hour workshop Monday morning, first one of the day, and we're kicking it off with the one and only Dr. Phil Ross. Morning, Doc.
Good
How
morning.
are you doing?
Doing great. How
All
about yourself?
right, we're doing good. We wanted to bring Phil in right off the bat today because we've got so many. Jamie and I gave you a little preview of the different modalities that he uses, but there's no better way than to see each and every one of them right here on the screen. I'm going to show you what they are. He's going to explain them and the benefits you can get from them. And then we're going to pull Philly Phil out from behind the board back there, stick him in one of the compression boots and show you exactly how it works.
All right.
So, Doc, you brought with you when you first got here, all these different modalities, but the big one
Yeah.
is this laser.
Yeah.
So tell us about it.
So absolutely. So long story short, laser therapy, it's one of the best things you could do that's non-invasive to promote healing in your body. So not only will it decrease inflammation, it's used immensely for reduction of pain. A lot of people with chronic pain, acute pain, tissue healing. Basically how it works is it uses photon energy. So laser therapy is
Explain that a little bit.
Yeah,
Is
so-
that light?
Yes.
All right.
So a good analogy is just how a sun hits a plant outside for it to kind of grow. Same thing. We are trying to use the photon energy from the laser to increase your ATP, which is the energy of your cell. So it just allows for immense tissue healing.
Okay.
Yeah.
Good. Now the power of light, right? I mean, this is what we've talked about this in a lot of different ways.
Yeah.
We do the Oligo scan, which is light photography as
Yeah.
well. So this is using the concentrated power of light.
Yes.
Now, it's a hot laser. Explain the difference between a hot and a cold laser.
Absolutely. So you have 4 classes of lasers. Just like if you got a laser pointer at the store, that's a class 1 laser.
Okay.
This is actually a class 4 laser, so it's the Rolls Royce. So it actually has a thermal effect to it. How we use that in our favor for treatment is with a thermal effect when collagen, so all your tissue is made out of collagen. When that reaches a warmer temperature, it becomes a little bit more pliable or mendable. So when we do the soft tissue work, you just respond a lot better.
Okay.
Same thing as if you try and bend a piece of rubber that's cold and a piece of rubber that's hot.
Okay.
Yeah, absolutely.
Good analogy. Like it.
Yeah.
So now you do it on primarily soft tissue.
Yes.
Right.
Soft tissue.
Do you use the laser on joints as well?
Absolutely.
Okay.
So a lot of people who are in chronic pain, they might go for a cortisone injection, lidocaine injections, a little bit of relief, not long lasting. What this laser does is it almost tries to reset the nerve to kind of tell your brain, hey, we don't need the pain in this area. And it actually does it by, it hits the cytochrome C in the mitochondria of your cell, so it increases the ATP. So it's just more cellular growth of the healthy cells.
Okay. And this is it right here.
Yeah, that's what she looks like right there.
Okay.
And basically there's basically no.
It's a little bit like R2D2.
Just a little bit, yeah. Basically no contraindications.
So then you have the handheld device, right? That's what you actually use to apply the laser.
Absolutely. So we have to wear glasses so it doesn't damage your retina. And basically we turn it on and you just go about 2 centimeters along the skin and you just hit everything with the laser. And that's basically how you do the treatment with it.
Yeah. Excellent.
Yeah.
Now, we had an interesting question once.
Okay.
When Doc first introduced the laser, you had somebody that wanted to get the therapy, but had a knee replacement.
Yeah.
Right.
Yes.
And was worried that the heat from the laser would heat up the metal in her knee replacement, right? Was that right? Now tell them what your answer to that.
So it is a deep penetrating heat. There are certain specifications, so you could either turn up or turn down the watts that are emitted from the diode and the laser. So when you have any kind of joint replacement, it really does work well. You just have to do a different setting. That's all it is. And that would just help for the tissue mobility around the knee replacement, hip replacement, whatever you have. And
but it won't set the metal on
fire. It
will
not set the metal on fire. It's not going to melt any ceramic.
Okay. All right. Good to know.
So, and we use this on a wide variety of things. So had a lot of relief and a lot of good results post-op. Someone comes in with scar tissue formation that is immense. And one of the big wins I was telling Phil 2 weeks ago was we had a gentleman. He came in for 6 laser treatments, and he went from 14 pounds of grip strength in one hand, and after treatment, he got to 62 pounds of grip strength. That is
incredible.
ridiculous. So
Wow, what a change.
pain free, no more numbness in his hands, and it was night and day. And his only thing he said was he wished he would have known about this before.
So talk about that a little bit. Scar tissue repair. I mean, anytime you have surgery,
Yeah.
no matter what they're repairing,
Yes.
there's scar tissue
Absolutely.
every
Yep.
time.
Yep.
So this is something that I don't think a lot of people even realize
Yes.
they can address.
Absolutely, yeah. So that's what's huge about this, and with the other modalities we have as well. So once we heat the collagen up with the laser, after you get surgery, your myofascia kind of organizes like this. It's all kind of intertwined. So once we heat up the collagen with the laser, we actually have it's called a Graston tool, you could call it. It's instrument assisted soft tissue immobilization. You kind of go over the muscle, and it'll allow the myofascia to organize more linear, so it takes out the scar tissue. Yeah, so you don't lose any range of motion.
Awesome. Now, is there anything you wouldn't use the laser for?
Yes, there are just a couple contraindications. Over a pacemaker, over a spinal cord stimulator, or over a malignancy. If you have a malignant tumor, because you don't want to promote growth of a malignancy. Obviously.
Okay,
Yeah,
gotcha.
so-
Good. That's it. Other than that, it's got a wide range of use.
Absolutely,
Right?
yeah, and getting fantastic results, especially with diabetic neuropathy patients in their feet. Yeah, controlled with the supplements as well.
Sure.
Yeah, absolutely. So,
So you mentioned that after 6 treatments, his grip strength went through the roof.
yeah.
So is that the normal 6 treatments?
Yeah, so if you look at the most recent literature, they recommend 6 treatments where you have the greatest therapeutic effect. So usually when I get people on the book for laser, I would like to see them 2 times a week for 3 weeks, just so it has the compounding effect. Because if you just came in 1 time a week over the course of 6 weeks, you'll feel better, but you won't have the greatest benefit.
Okay.
Yes.
So you like to space it out over a couple of weeks,
Yes.
a couple times a week.
Yes.
If someone says, "Doc, I just want to get all 6 in 1 week," what do you do?
You could do that.
You could.
Depending on the pathology
Yeah.
at hand.
Okay.
Yeah, but it would be nice to maybe break that up.
Yeah.
Absolutely.
What got you interested in the laser?
So when I was in grad school, we had one at our clinic, and we actually had a patient who was a quadriplegic, and he had an ulcer on his foot, and he went to every ologist you could think of under the sun, and they were going to end up amputating his leg. And so last ditch effort, he went to the chiropractic clinic, and when he came over, we had a class 4 laser at the time out in St. Louis. And we treated him twice a week for 14 weeks, and it closed the ulcer on his heel, and he did not have to get surgery, and his leg amputated. So at first, I was like, "This is just a warm leg. That's not working." But when you see it firsthand, it was a no-brainer, and it's helping everybody. Yeah.
So surgery prevention.
Yes.
Wow.
Yes.
We're always looking for ways to prevent surgery.
Absolutely.
And this is amazing. So you
Absolutely.
prevented an amputation
Yes.
of foot.
Yes.
That's a great. Was that diabetic related?
Yes,
Was
yes, and since he was a quadriplegic, obviously with the lack of movement, and bed sore,
atrophy, the whole works.
Yes.
Okay, awesome.
But that was an unbelievable one.
That's great.
Yeah.
So, folks, all you got to do is give us a call, 412-922-9355. Set up an appointment with Dr. Phil Ross, and check out this laser therapy. It's we're getting into Star Trek modalities here. I remember seeing Dr. McCoy with the old handheld thing going over everybody, right?
Yeah.
But it's I guess I'm dating myself. But yeah, absolutely. And this is the kind of thing that we're bringing to the table. What else? Let's go. That's your laser. Got anything else on the laser you want to cover?
Yes. Well, what actually works in conjunction with that is we were talking about heating up the tissue, right? For the scar production. So.
Yep.
If we heat it up, and we actually use this called a Graston tool. So a lot of people say it's a glorified butter knife. And so once we heat everything up and we go over the soft tissue, it's going to allow the myofascia. So it's basically the pantyhose surrounding your muscle to organize in a more linear fashion. So some people call it muscle scraping, use it on a ton of athletes and people with chronic injured soft tissue. So a lot of people are tight.
And you usually do it after the laser?
Yes.
Okay.
Yeah, just because you get more bang for your buck, so to speak. So
yeah. I remember when this arrived.
Yeah.
And everyone was going, "Joe, is this yours? What do you?" I thought, well, what am I going to do with it? I mean, look at this. but it's his grass.
Yeah, yeah,
That's awesome.
and it facilitates the healing process, and it actually helps the formation of a new extracellular matrix for the proteins, which is collagen. And it increases collagen production, improves mobility, and alleviates the chronic pain condition. So if you're fresh out of surgery within a couple weeks and you heat it up and treat it with the laser therapy, and then get over it with the Grasson tool, you're not going to say, I just tore my bicep. I don't have my full range of motion, because sometimes the bicep tendon's fully healed, but it's your skin and that fascia and scar tissue that's holding you back. So
Interesting.
yeah, so you could heal everything deep with the laser, but then when you heal the scar, that's the Grasson therapy.
Good.
It works great. Absolutely.
Awesome. So
Yeah.
scar therapy. That's a lot of people are interested in that
Yeah.
because there's no other way really to address it. You can do all these topicals; they're not going to work. You
Yeah.
have to actually get into the tissue.
100% agree.
Right?
Yeah. Yep. And that works because when you have like a tight trigger point or scar tissue, the myofibers organized like this, and when you go over it, they're more linear, so you just have a more range of motion.
Okay.
Yeah. So it doesn't shut you down.
All right. Great.
Yeah.
What's next?
So that was the muscle scraping or the instrument-assisted soft tissue mobilization. We have the laser therapy, and the other thing I would say everybody's favorite toy is it's called Hypervolt. So it's basically a percussion gun, and what it does is
you might want to show them how that works. Go
Yeah.
ahead. A little demonstration.
yeah. So basically, what it does is what a percussion gun does is you have it's called a muscle spindle and a GTO, which is a Golgi tendon organ inside the muscle belly. And when you rapidly tap a muscle, it sends an afferent stimulus to your brain, efferent back down to the muscle, and forces it to elongate and relax. So everybody, when they get
Can't tell you how good that
yeah,
is.
so yeah, everybody always says, Doc, can you cancel your next appointment? I can lay face down for half an hour and you can sit my whole body. But it's just nice to get the muscles to relax. So
Right.
when everybody's in chronic tension state,
That's
once you reset the muscle spindle and the Golgi tendon organ, people just relax and just muscles melt like butter. Yeah, so that's everybody's favorite. The other modalities that we brought to the table.
Yeah, I think when we got this here, Jamie ordered 2 for his house.
I bet he did. I bet he did. And then next,
Why you needed 2? I don't know.
And next we have the Normatec compression therapy. So
Okay.
if maybe we could grab Phil and put them on, and while we explain it, we can see it pump up.
Okay.
You want to do that?
Yeah, let's bring Phil out from behind the camera. He didn't know he was going to be on camera today, so he didn't go to hair and makeup.
Yeah. Should have got my haircut. Yeah. You got a seat right there, and you want to pop the shoe off? Maybe, sir? And then maybe sit in this chair, face the second way. Yes.
So normally there's a table back in one of the treatment rooms where you lay down nice and comfortable, nice big screen TV up there, you sit down. We could even do a little mood lighting, that works too. And but you get, and you would normally put both feet in the compression boots, but we're just for demonstration purposes, we're going to show you one.
Yes. So this is widely used, especially by the athletes.
Mm-hmm.
So if you look at every big D1 school and a lot of the professional teams, they all have these on those are all in the treatment room. Athletes travel with them. Long story short, it decreases recovery time. So every time you're moving, your body is always generating metabolic waste as you produce energy. Walking, exercising, you name it. So,
Now,
yeah.
Explain it when you talk about this to people, you say it's like, you're going to feel like a compression. It's like having a blood pressure cup on your whole leg.
Yes.
Right.
Yeah. So what this does is, and we'll just jump to it. The difference. A lot of people ask me, "Hey Doc, can I just get compression socks at home instead of
It's
using?"
filling up,
Yeah.
and that's
Yeah.
So it's compressing and releasing, compressing and releasing.
Yeah, so a lot of people always ask me, "Hey Doc, can I just do compression socks at home?" And you can, but the good analogy is think of a roll of toothpaste at the end. So you squeeze the toothpaste out, and then what do you do after when you think you're done? You slowly kind of increment and go through the different compartments to kind of get all the toothpaste out. So that's the main difference. This uses pneumatic compression to decrease all the faulty metabolites, the wasteful metabolites out of your legs. Lactic acid gets highly oxygenated and nutrient dense when it gets recycled through your lymphatic system. in your vital organs, and then you just get the great blood flow to increase recovery back down to the distal part of your foot there. So
now, doesn't it starts like the compression starts at the foot and then works its way up?
yes,
right?
yeah. So a lot of people with like varicose veins, a lot of people with any kind of lymphatic disorders, this is fantastic for it because it's below your heart. So sometimes if you have any kind of vein issues, you can't pump the blood efficiently back to the heart.
Well, we get a lot of different calls about varicose veins.
Yeah,
So,
and it really
have you
helps.
used this for a lot of people in that respect?
Yes, absolutely. Okay. Yeah, it really helps.
Yeah.
So
and you would put, and there's different settings for the amount of compression, right?
yes, yeah. So one of the contraindications is if heart problems. So if you have any kind of severe congestive heart failure or anything, then we put it on a low setting still just to push all the wasteful metabolites through the lymph tissue.
Right.
Yeah,
And it's all about comes down to circulation.
absolutely increases circulation, blood flow, reduces swelling and water accumulation, which is massive too.
That's good too.
And so yeah, it just does it by pneumatic compression, which is big. Yeah.
So a lot of times people have issues with the lymphatic system.
Yeah.
Right now, and they're and you have a system in your body called cardiovascular system that has a pump, which is the heart.
Yep.
The lymphatic system doesn't necessarily have a pump, right?
Mm-hmm.
So you have to somehow trigger it, get it started, get it moving.
Got to manually.
This is one of the great ways to do that. Right?
Yep. Yeah, absolutely. So, and we just wanted to throw Phil on just for a quick demo. You want to stay on? You want to pop back on? Okay. Okay. All righty.
And then when you come out of these, Phil's favorite saying is you feel like you get a new pair of legs.
Yeah.
And you do. You feel like you have a new pair of legs. You really do. I mean, you could be standing all day, working all day, get in the compression boots, and you feel like you just started. So excellent modality for everybody to try. I mean, even just if you're sore from a workout, it's great. Gets the blood flowing, and that's the main issue. Now, we have that available here at the Wellness Center. And what do we charge for that?
So that is usually we do 5 sessions for $100, which is a great bang for your buck too.
And they're 20-minute sessions?
30-minute sessions.
30-minute sessions.
Yeah. And so you go on and like we were talking about in the recovery room, TV up there. You can jump on your phone, and basically you're just increasing your blood flow. And a lot of runners, a lot of the runners really like the boots, just and athletes at a high level.
Yeah, I've seen you have a lot of runners come in.
Absolutely, yeah.
Now, is this something that you would do right after a chiropractic appointment as well?
Yes.
Or separate from, or both?
So it could be either or. So I have a lot of patients coming in. I'll treat them, and if they have heavy legs, so to speak, we'll put them in the boots after their session, just so everything recovers. Yeah, absolutely.
Okay. And then, yes, question.
What about sciatic pain?
So that
sciatic pain is the question.
So that can help with sciatic pain. Now, what we could really use for the sciatic pain, obviously the chiropractic treatment is probably the best thing for that. The boots will help if it's a peripheral nerve entrapment. So in that muscle, the dreaded piriformis muscle. But the laser actually really helps with the sciatic pain. So speaking to that, when you have sciatic, it's basically a swollen nerve, and it keeps depolarizing. So that's when you feel the pain running down your leg.
Yes.
How we get rid of that is the decrease in the inflammation. So that is 100% what the laser does.
Right.
Coupled with, you got to do your homework at home with certain stretches that I like to give patients.
Yes.
Certain exercises at home.
I mean, and a lot of it's structural, right? I mean, you
100%.
have to release it. And maybe there's things that are constricting.
Yeah, right? Absolutely. So
we always tell them to come in first.
Yeah.
To see you first if they have sciatic.
Exactly. So and it could be from 2 different structures. So it could be from a disc bulge or a disc herniation, or it could be an irritated nerve root. So if it is from a disc bulge or disc herniation, you got to get on an anti-inflammatory. X-Flame's massive. You got to get on that. You got to do your ice at home. I go over different exercises and stretches to kind of help heal the disc in the treatment too. So when you have a disc bulge or disc herniation, sometimes we'll just call it chemical soup. You have 8 main inflammatory proteins. Hit on that nerve root, nerve swells, and you feel fire down your leg. So that's why using the laser to kind of seal that disc back up, coupled with the X-Flame and all the anti-inflammatories.
I'm sure most people have experienced sciatic pain at some point.
Absolutely.
I know I have.
Yeah.
And when it's bad, it keeps you up all night.
Yes, it does.
It's because you can't. There's no position that's comfortable.
Yes.
Sitting, laying, it doesn't matter. And
Yeah.
it can be debilitating.
And that's what's great about our clinic over here. Me and Dr. Orbach, we use some of this called the McKenzie protocol,
Yeah.
which is the gold standard for any kind of radicular symptom. So low back pain running down your leg.
Okay.
So that coupled with all the modalities we use, people heal very, very quick. Very, very quick.
Excellent. Good
Yeah.
question. Thanks for your question.
Yeah, yeah.
So what do we have next?
So would the boots help for the sciatic?
Okay.
If you have tight muscles that are kind of compressing that nerve, absolutely. You might feel the symptom momentarily while you're in the boots, but how we were talking, it pushes all the lactic acid and the waste buildup from the metabolites in your leg. It pushes that all away so that nerve could heal.
Gotcha.
Yeah, absolutely. And the last modality we brought to the table was the cupping therapy.
Okay.
So cupping has been used as ancient Tao medicine. This has been going on for hundreds of years.
Ancient Chinese secret.
Yeah, yep, absolutely. So there's a couple different ways to do it. Practitioners
Can I
all
still
practice
say
it differently.
Chinese, Phil? Am I allowed to say Chinese? Okay. I can say Chinese.
So there's practitioners do it differently. When you think of the ancient time, it's usually the glass cup with the big flame under it and put it on.
Yes.
Yeah.
Yes.
So, and there's two different kinds. There's dry and wet cupping. Wet cupping technically is when you actually kind of like draw blood.
Oh, really?
Yes. Yeah. But we do dry cupping here. But I also do something that's called it's like a transdermal. So depending, just a good example is golfer's elbow. A lot of people with golfer's elbow. If we get the cup on and actually kind of roll the cup over those tight tendons, they respond great too.
Oh, so this can be a mobile therapy as well,
Yeah.
not just stagnant.
Yeah, so that's the cool
Oh,
thing about
okay.
this clinic. When you go to a lot of different providers, they just put them on and let you sit for 20 minutes.
Now there's multiple cups
Yes.
that you use, right?
Yeah, yeah. So this is just like one of the ones they look like. They vary in size.
Right.
We have 24 of them back there.
Okay.
And so usually if someone has a low back injury, not only will I treat the low back, but I'll assess the mid back as well. So it increases circulation. So you're getting the good blood flow to the area so you can heal. And that's the good thing about the laser too, is we bring all the good blood flow and ATP production to the area. And then when you put the cup on, it'll actually pull it to the skeletal muscle. So you just you heal on steroids.
So it's suction.
Yeah,
Yes,
suction cup.
right?
Yep, absolutely.
Okay.
So it facilitates healing with blood flow.
Okay.
And it increases the circulation, and it promotes cellular repair, and it relieves muscle tension. So a lot of people coming in with tight upper traps. A lot of people who are, doc, I'm chronically tight. What do I do? What do I do? Cupping works great for that.
Okay.
It really, really does. Yeah.
Now it has to go directly on the skin.
Directly on the skin.
Okay.
Yes. And sometimes patients will have bruising after, but I don't leave them on for, an hour. So you don't come out and you're like, what the heck did he just do to me?
Like he's had a fight with an octopus.
Exactly. Yeah. Yeah. So, we depending on the pathology at hand is how long the cups will stay on.
Okay.
But basically we're using it to get the good blood flow to the area to promote healing.
So let me ask you this then. In some extreme cases, would you use every single modality on the same patient?
It depends. Yeah. It depends on the body area. Depends on what the injury is. But there are multiple patients that I will use both cups and Graston on patients.
Right.
Yeah.
Right.
Just
or
because
cups and laser.
Yes. Yeah. Cups and laser. Just depending on how the tissue is and what they're coming in for, you could use all of them. Yeah.
Okay.
Absolutely.
Do you charge separately for the cupping?
Do not. It's all included.
All included. There
All
you go.
included, yeah.
Excellent.
Everything's included. The laser treatment is separate.
Yes.
Or you could still, I'd say vast majority of my patients, they'll come in for the treatment. I'll use the laser on them, just a small additional fee. And that's most of the patient population.
Okay.
Yeah, absolutely.
So now, Doc, your other specialty we know is golfers.
Yeah.
Right?
Yeah.
And you have a certification, right? From
Yeah.
Titleist. Tell us
Yes.
about that.
So I am Titleist Performance Institute. So it's the TPI certification. So I'm a level 1 medical provider. So what that basically means is a lot of people sustaining golf injuries coming in, whether it's, most common low back. Some people it's ankle, some people elbow,
Really?
some people wrist. And basically the TPI protocol is you take them through the 15 major biomechanical movements in a golf swing,
Okay.
assess them, see what's proficient, what's deficient, and either give corrective exercises or you do some soft tissue therapy to increase the golfer's longevity.
Okay.
So that's
Now, I really haven't seen anybody in here with a golf club.
no, well, it's
You know
in the back room.
It's in the back room?
Yeah, it's in
Okay.
the back room.
All right.
Yeah.
So do you actually assess their swing?
A little bit, yes, yeah.
Okay.
So you take them through the 15 major movements in the swing, and you see where they're having pain.
Gotcha.
And what's nice about the TPI is it's totally tailored to a golfer. And the best is when someone comes in, you treat them 2 times, they're like, "Doc, I played 18 holes pain free." That is the best.
Okay, so let's
Yeah.
make sure they understand. You're not their golf coach. You're just relieving the pain.
Yes.
So when you
Yes.
analyze their swing,
Yes,
it's to relieve pain,
absolutely
not to increase their game.
on a
No.
no results vary.
Results vary. Okay.
Yeah.
Okay.
Yeah. So but yeah, it's nice just to relieve the pain, and we can and yeah, you basically, if you are pain free and we add some mobility to certain joints and tissues in your body, it's not uncommon people put 5-10 yards on their swing.
Okay.
Not uncommon at all because they're healthy and they have more tissue elasticity.
Good.
Yeah.
Excellent.
So the TPI certifications, that's one of my favorite things to do, just because I'm a golf guy. I caught the bug, so it's pretty fun to assess golfers.
Good.
Yeah.
Excellent. Now, both you and Dr. Orbach do treat a lot of sports injuries,
Yes.
right?
Yes.
And is that something that you think you do more of than just basic wear and tear mobility issues, or what do you think is higher on the list for your patient base?
For my patient base, I think it's more mobility and kind of just lifestyle.
Mhm.
So my goal when I got in the chiropractic profession is increase people's quality of life.
Mhm.
So I love working with athletes, but I also like working with everyday folk as well. So it's just nice to come in and have someone say, I couldn't reach and grab my seatbelt to put it on, and I don't even think about it.
Nice.
Or, I have a 2-year-old granddaughter, and I was having pain in my back picking her up off the floor, and now they do it pain free. Yeah. So
That's good stuff.
absolutely.
That's real good stuff. Then you also work with one of the boxing champions, our local boxing champion, right?
Yeah.
What's his? What was his weight class again? He's the
He is
Intercontinental champion.
Yeah, for the IBA, International Boxing Association.
Okay.
Matt Conway.
Matt Conway.
Big fight coming up January 15th. But yeah, so work with him.
Yep.
He's fighting at 131 pounds, I think, in January, and he comes like clockwork. He's
Yes,
in
he
here once
does.
a week,
Yes, he
because
does.
if you beat your body up, you need the therapy.
That's right.
If
it's good enough for a boxing champion, Intercontinental champion, it's good enough for everybody.
And he's going for the world title in January here.
Good.
Yeah,
That's awesome.
Absolutely. So
we'll be there.
Yep. And the other thing we do too is so this is kind of more in the chiropractic realm. It's called ART, active release technique.
Mhm.
So a lot of people call it pinning and stretching. So we use all the modalities for the tight muscles, but then me and Dr. Orbach get on trigger points. So active release technique in a nutshell is, say you're working on a bicep, you shorten the muscle down, compress the trigger point, and then stretch it out. So it basically elongates the muscle.
Okay.
So people respond fantastic to ART and FST. So that's when Jamie always says, I feel a lot looser. That's when I'm doing the stretching.
Yeah. Now, is this something that would work, specifically well with people that do a lot of resistance training?
Yeah, absolutely. Right? Yeah. And it works on, everyday folk as well. So if someone has a chronic knee complaint going on for years, usually their quadriceps tendon or some of their quadricep muscles on the anterior portion of their thigh are way tight.
Yes.
You could do the cupping, you could do the Graston tool, but sometimes you just need to get in there manually and release the tissue. And that's what the ART does, coupled with the FST, which is the fascial stretch therapy. So the pantyhose surrounding every single muscle, it kind of gets on that and just releases that as well.
Mm-hmm. So the bottom line here is, folks, we have all these great tools, these great additions to the service, but it's really all about the chiropractor. It's about the physical manipulation. That always comes first.
That's the groundwork. That's where it starts. Every time you come in, thorough assessment, and then these are just nice. Just it gets people better a lot faster. And that's why we kind of brought them to the team, just because. I hate when people come in and they're like, I was seeing a chiropractor for 30, 35 visits. They try to sign me up at first, and it's like, wait a second, what if you get better in 6 visits? And my goal is just to improve people's quality of life as quick as possible, and that's why we brought the modalities on, because it helps.
Awesome.
Really, really helps.
Great. Well, there you have it, folks. Everything that Dr. Phil does in a nutshell. So, but this is a lot of the things he uses is in conjunction with each appointment.
Yes.
That you come in for.
Yes.
The only things that are additional as far as charge are the compression boots.
Yes.
And the laser.
Yes.
Everything
Yes.
else is part of the program,
Yeah.
and they're really at a great price. I mean, the laser treatments,
Yeah.
6 sessions for $199.
Yes.
Is that what it is?
Yeah.
Right?
Right now we're running a special, which
Running
is
special $199.
substantially lower than a lot of other clinics.
Right.
So just because we want people to see the results you can get,
Right.
just want to improve people's quality of life. So come in, check it out. You will feel great. You will be pain free. Reset the pain fibers, and it's helping a ton of people.
You know, it's
Yeah.
great. We're going full circle. This whole thing started with the pain release clinic.
Yeah.
And here we are. We're addressing pain in a whole new way with
Yeah.
high tech.
Yeah.
Right?
Oh yeah.
All
Absolutely.
right. Well, give us a call. Get an appointment with Dr. Phil Ross, 412-922-9355. Or just come on in and meet him.
Yeah.
He's one of the happiest guys you'll ever talk to.
Yeah.
Yeah.
Pretty booked up this week. I am accepting walk-ins right now. I think I have a couple on Thursday openings. Friday's gonna be hard to get in. Wednesday as well, but come in, have a consultation, sit down, and we'll talk about what you got, what's ailing you.
Excellent.
Yeah.
Well, there you have it, folks. Any parting shots, Doc?
Come in and get treated.
There you go. Come on in.
Even if you feel good, you just come in and get checked
That's
out.
a really good point, though.
Yeah.
Let's finish on that.
Yeah.
Do you need chiropractic if you feel good?
I would say so, because I mean, it's better to come in and get checked periodically as opposed to now I can't move.
Right.
Yeah.
Prevention.
Yeah. Oh
Right?
crap! I sneezed and now I can't get in and out of my car.
Yeah.
So before you get to that point, and then
Yeah.
it takes a lot more treatments. Come in and just get checked out. You know, and just get some maintenance care, and so you don't have anything that will kind of flare up on you.
Gotcha.
Yeah.
Perfect.
Yep.
Well, there you have it, Dr. Phil Ross. That's a great explanation of everything he does. Folks, at 10 o'clock, the one and only Dr. Len Bransovitz from Florida. And he'll probably have the sun shining in the background, so we'll give him some heck about that.
Yeah.
But anyway, no, Dr. Len's coming up next, and we're going on for the rest of the day after that. But we'll see you then at 10 o'clock. Dr. Len Bransowitz from Florida. Dr. Phil Ross.
All right.
Thank you,
Always
brother.
a pleasure, Joe.
Yes, sir.